Exem Foam Kit, tuba foam, a new way of looking at tubal patency. Exploratory fertility assessment consists of 3 important phases: establishing that ovulation occurs, establishing the semen quality, and establishing whether semen can reach the female germ cell. In other words, whether the fallopian tubes are patent. This film is about Exem Foam Kit, a simple way of assessing tubal patency by means of an ultrasound scan. The fallopian tubes can be examined in various ways: hysterosalpingography, or HSG, and laparoscopy. These methods provide much more information than about the tubal patency alone. There's another method, hysterosalpingo-contrast sonography, or HICOSY. HICOSY assesses tubal patency by inserting an echogenic medium. HICOSY has been thoroughly researched in the past 15 years. Many studies show that HICOSY is as accurate as HSG when it comes to assessing tubal patency. Relatively recently, detailed interviews and commentaries have appeared in the leading specialist journals Fertility and Sterility and Human Reproduction. Fertility and Sterility published a review covering 18 studies, one of which encompassed more than 1,000 patients. These studies compared HSG and laparoscopy with HICOSY. The review showed that diagnostically, HICOSY is just as effective when it comes to assessing tubal patency. Conclusion: HICOSY is an excellent method with the added advantages of simplicity, lower costs, it takes less time, and very importantly, it is much more comfortable for the patient. Exem Foam Kit is simply an improvement on the old HICOSY technique. The difference lies in the composition of the gel. It represents a great improvement on the no longer available Ecovist and has no adverse effects, which was sometimes the case with Ecovist. Exem is a safe gel that, when mixed with purified water, creates a tuba foam with millions of tiny air bubbles. As air is a poor conductor for sound, the Exem tuba foam provides a very accurate ultrasound image. Millions of tiny air bubbles create a mass of small white dots which make the image very bright and white. This provides a clear view of where the foam is. Exem Foam Kit is a complete set for mixing and insertion. A cervical adapter is used for insertion. It is inserted into the cervix, and it is very important to use a half-open speculum, the column speculum, so that it can be removed, leaving the catheter and the tip in the cervix. The specially developed cervix catheter allows easy and virtually painless insertion of the foam. The soft pressure of the foam causes the fallopian tubes to open and fill up. The patient suffers little to no discomfort because there is virtually no pressure buildup. Insert the foam slowly. The ultrasound will show whether the fallopian tubes are open. Here are some ultrasound images. What do you see? Can you assess whether the fallopian tubes are open? Let's look at these images again more closely, and I will tell you what we are seeing. This view is from the bottom upwards. This is the ultrasound transducer, this is the womb and AVF, and this is the abdominal wall, and this is the woman's back. This is where the tip of the ultrasound is. I inserted only a tiny little bit of the foam, and you can already see that it flows straight to the fundus. Now I'll turn it a little bit to the left and to the right, and now I'll turn the probe about 90 degrees from a longitudinal cross-section to a transversal cross-section. Here, this is the transversal cross-section, and you can see that this is the right, and this is the left, that the right fallopian tube is filled immediately, and then we focus on this right fallopian tube where you will see the foam appear in a moment. It will really overflow into the abdominal cavity. Even if this doesn't happen, and you can only see a nice, thin, slender fallopian tube, it still means that it's open. After all, a blocked fallopian tube could never produce such a very nice, thin, slender reflection. On this side, this fallopian tube cannot be viewed so well as it winds a lot, but you can see clearly that the foam is appearing next to the ovary. And look, here you can see that nice, long, white line, the fallopian tube. I keep turning the tip to follow the foam. Oh, here you can see the winding. It's so beautiful. The foam fills up to the fundus, And now we move a little bit to the side and from longitudinal to transversal, and then you can see the first fallopian tube come up immediately. There's a great deal of peristalsis, a lot of movement around it, which can sometimes make the ultrasound difficult. This is not the easiest to see, but it's very nice. The fallopian tube turns with a sharp twist and then back again, turns straight as it comes back from the womb to continue behind the womb. Look, this is behind the womb. Here is a cross-sectional image. You can see how nice and thin the fallopian tube, but it's even clearer in the next bit. Now, we'll look at the other side first. See how the fallopian tube makes an enormous bend? But that's also clear to see. Behind the womb, there's a very nice thin winding fallopian tube. Let's go back to this one. There'll be several fragments that show this very clearly. Here is another thin, nice white line, a healthy fallopian tube. At the end of the film, it becomes immediately and completely clear. Now, I'll try to make this one as long as possible. I'm going to try and turn with the tip of the ultrasound. Here you see that nice thin continuous white line. Look, there it is again. Now, if I freeze the image, look, you can see a beautiful fallopian tube, and if you look closely, you can even see the tubofoam bubbles here. Look here, this funny white line is the foam. You cannot see the ovary so well on this side, but you can see the foam coming through very clearly. This is the ovary, and this is the foam next to it. This is how you know that the fallopian tube is open. The advantages for doctor and patient are clear. Patients can now be examined at the familiar outpatient's gynecology clinic. Neither the gynecologist nor the patient have to go to radiology, saving time and money. Moreover, this examination is very patient-friendly and causes relatively little discomfort. This new method can replace painful HSG in at least 80% of the cases. In addition, this simple examination makes it possible to assess tubal patency in an early phase of the fertility assessment. The Academic Center of the VU University in Amsterdam conducted research on the Exem Foam Kit and concluded that it is half as painful, half as expensive, and takes half as long. Exem Foam Kit. Tubofoam, a new way of assessing tubal patency.